So we're starting module 3, and it's 3 chapters, just 3 chapters, and not nearly as much stuff as we did in the past, thank goodness, because we're running out of time, right? So I posted the objectives, and today's lecture, and then I'll post the next one. I wanted to make some changes to the skin one, but I'm just not going to have time, and I want to give you guys as much time ahead of time to look at stuff ahead of time, right? So I'm just going to, after today's lecture, I'm going to go ahead and post the skin one for you guys here as usual. And then the other thing, we usually have this unit, is another discussion board, right? If for any reason you haven't finished any assignments beforehand, you guys really need to, because next week is going to be like crazy grading week for me, right? To get going towards the end of the semester. So you need to get that done. So I'm going to post the discussion board here after, and you'll have 2 weeks to do it. I also moved back the test, obviously, right? But that makes it really short for the last test. But I've got a solution for that I'll tell you guys later. I don't want to let the cat out of the bag too soon. So, so you'll see that Test 3 is moved to the 19th, which is a Tuesday, and then the last day of class for us, that Thursday the 28th, will be Test 4, which doesn't give us a lot. And then, of course, our final exam is May 5th. May 5th. May 5th. Yeah, we're going to the Hibernia Center for testing for final as well. Final exam testing as well. I always go to the Hibernia Center. So the other thing is that one person did a makeup yesterday, and I will turn on the test for you guys to be able to review your results, which you want to do that as soon as possible. So literally after I get done lecturing today, I'll be doing those things I just said. Okay, so let's go ahead and get into today's lecture. So today is wound infections. So before we can really talk about the different infections in general, we need to know about wounds themselves a little bit, right? So there are some situations that increase the chances that a wound will become infected, right? So every time you get a cut, it doesn't always get infected, right? And that has to do with several different things. So let's think about this for a minute without looking at your guys' stuff. What do you think contributes to whether that gets infected? So you've got a cut, right, and bacteria get in. What is it about a situation that sometimes it'll get infected? It's not clean, right? So that's our number one thing, right? We always want to clean it because an open wound leaves accessibility to microbes, right? So we want to clean it, so hopefully we remove any that may have gotten in at that breach, okay? What's another thing? So say you clean it, but you don't get them all. And what's the problem with bacteria? Are all of them bad? No, but some of them are, right? And so does it matter what bacteria got in? Absolutely, right? So it's really important that, you know, and why sometimes they get infected is that bad luck, right? A bad guy got in, right? Does that make sense to you guys? And it really depends, too, how bad that bacteria is, right? How what we call virulent it is. How good is it at evading your immune system or even shutting down your immune system, right? Because that's our defense. So remember, there are some bacteria out there that can avoid phagocytosis, right? That can use our antibodies against us. There are others that avoid phagocytosis, that can get out of a phagosome, right? That can use our antibodies against us, that can evade complement activation, right? Opsonization by C3b, right? Things like that. What else do you think takes into consideration? So if it's a bad bacteria, also the bacteria themselves, right? How many do we need to cause an infection? Depends on the bacteria, right? So as little as 10 with tuberculosis. You inhale 10 bacteria, you could get tuberculosis. 10 of them, right? Where things like salmonella, you usually have to ingest thousands of them, that some of them slip through the intestines the stomach and make it to the intestines, right? So does the number matter? Yeah. And what we refer to as infectious dose, right, is the minimum amount you usually have to be exposed to actually cause an infection. So let's look at this list, right? So how virulent, right? How bad is the bad guy? How many of them got in? And then, of course, your immune system is what helps defend you when stuff gets in. Well, what if you're an individual where your immune system is compromised, right? What if you have HIV? Or what if you have an organ transplant? Is your immune system compromised? Yeah, because you're taking what? Immunosuppressant drugs to keep that organ, right? Keep your immune system from destroying that organ, but that leaves you more susceptible. And then you have the nature of the wound itself, and that's what we're going to look at next, right? And especially when you have crushed tissue, right? When you have damage to a lot of tissue. Right? This makes it difficult because remember, how do the white blood cells get to where they need to go? They get into the tissue via the what? The blood, the circulatory system. So if you have blood vessels that are damaged, right, then they're being clogged up and patched, right, so the blood isn't leaking uncontrolled into the tissue. But then that impedes the movement of the white blood cells in because they can't use damaged blood vessels, right? It's got to be intact blood vessels to get there. And then if you have foreign material, like when you get a splinter, why are you so obsessed about removing it? Well, because it could be harboring bacteria itself, right? And again, it's a foreign object. It doesn't have a vascular system, right? It doesn't have a circulatory system. So instead, you have this foreign object that's leaking pathogens into you, and you have no way to get into it and destroy them. You can only destroy them when they're in the body, right? So you need to remove any foreign debris, right? Because it could be a source of infection. And again, typically those type of wounds sometimes, again, because your white blood cells can't travel into the splinter. That'll keep festering and festering because they're going to keep coming out of the splinter. And you're not going to be able to eliminate the source until you remove the source, in that case. Remove the splinter. So virulent. That refers to an organism's ability that aided in overcoming the body's defenses, therefore causing illness or disease. Now, they don't always do this forever, right? Sometimes we'll eventually win the war. But the fact that they're winning at one particular time more so than we are, that's what contributes to illness and disease. So things like capsules, right? So bacteria, when they have capsule, this helps them avoid detection by phagocytic cells, right? So that allows them to persist, right, until we say make an antibody against it, and then use that to opsonize it and recognize it. Remember, how about how long is it going to take us to make an antibody? 7 to 14 days, right? In the meantime, this guy is just growing like crazy, eating us, right? Remember, we're the big fat juicy cheeseburger. Toxins, these are really scary because they can very easily hop onto our superhighway into our circulatory system and travel throughout the body. Right? They can travel and go more places faster than bacteria can. A single molecule can destroy a cell. And so some of the most pathogenic organisms that we deal with are toxin producers. Those are the really scary ones. So for instance, tetanus, right? So there's 5 different categories that we put wounds into. You have an incision, usually made by a sharp object like a knife or a scalpel. And this tends to be a nice, clean cut, right? Puncture wounds The problem with these is that there's a small puncture in the surface, but the wound goes deep, right? Puncture means it goes deep. So a needle, a nail, even a knife if plunged into somebody, right? Lacerations, the problem with them is these are cuts that have torn, jagged edges. So not a nice clean cut. Contusions, this is where usually there's a crushing blow to tissue. What do we commonly refer to contusions as? What do you see afterwards? You see a hematoma that we commonly refer to as a bruise, right? So when you have a bruise, right, you've crushed tissue. Depending on the extent, right, determines the likelihood of how much potential damage is there. The good news is most of the time when we do that, is the skin pierced? No, the skin stays intact. When the skin doesn't stay intact, that's really bad news, because then you have microorganisms that could be introduced into that area. And remember, if you're seeing bruising, what got damaged along with the tissue? The blood vessels, right? And those are what are so very important for inflammation and for healing. And why it takes so long, right, for that to go away, right? All that blood that leaked into the tissue. It can take quite a long time because we've got to repair that superhighway that got damaged. Burns, probably some of the worst, right? And you can get different types of burns. Most of us have experienced thermal burns, right, due to heat. But electricity can burn quite extensively. Chemicals can burn, radiation, or even friction, right? If you ever experienced, rug burns, right? Or road rash, even worse. In microbiology, we work with a really strong base at one time. And I'm not a big fan of wearing gloves because I worked in research for several years where you live in gloves, right? So sometimes in the microbiology lab, I don't put gloves on. And there's one experiment we did yesterday, and I'm like, y'all, make sure you have your gloves on, because one time I didn't put them on, and I dropped that acid on my hand. I mean, that base, a strong base, burns bad. Burns bad. It hurts, right? And it was just a drop. Can you imagine if I spilled the whole bottle on myself? Whew, that would not have been good. So, yeah, I'm really good about wearing my gloves when I do that one technique, right? Because I don't want to get that chemical burn. Okay. Gunshots, right? So, again, what's the problem here? You have a wound, but usually you also have what? A foreign object in you, right? You have a bullet or other projectile that needs to be removed. And then, of course, the damage it made going in and how deep it went in and where it went, right? All these factors come into play to how severe that type of wound can be. So we're going to help us understanding of these, and one of the really important components that can affect wound care is if an anaerobic environment happens. And there are some wounds that are more prone to this type of environment happening. And a large part of the problem here is, again, if you have damage to blood vessels, so you don't have flow of blood into the area. Remember, those red blood cells are carrying what? What do red blood cells carry, y'all? Oxygen, right? To feed those tissues, to feed those cells. If you don't have blood flow into that area, is it oxygenated? No, it can become what's referred to as anaerobic without oxygen, which is really bad for our cells. It doesn't help promote healing because they're not getting what they need. And then the second punch is that some microorganisms can grow anaerobically. So the fact that it just became anaerobic doesn't stop them. It actually, for some of them, it's going to allow them to grow. So for instance, with Clostridium tetani, which is a spore former, it's also an anaerobe. So if those spores get into your body and you have an anaerobic environment where they got in, they're going to germinate and grow. And then what's the second part that's really bad with tetanus? They're going to grow and produce toxins, right, that can spread throughout the body. So as we look at each one of these and give an example, right, we're going to be explaining if an anaerobic environment is likely to form. So a paper cut, right, that's a very easy, right? Most of us have experienced it numerous times, teachers more so than not, right? All the paper reshuffle. Not so much nowadays, thanks to computer assignments. Thank you. Modern technology from saving me. So this is usually, right, again, a clean cut, right? Paper can actually be quite sharp, but usually it's minor, right? Doesn't cover a large area, doesn't go very deep, therefore doesn't cause a lot of damage or tissue death. It's very unlikely that that would produce an anaerobic environment. And sometimes they don't even bleed, right? When you get a paper cut. When they do, right, that's when you go and you wash it and you put a Band-Aid on it, right, to help protect it. Puncture wounds, on the other hand, right, so for instance, stepping on a nail would result in a puncture wound. This type of wound produces a small surface wound, right? So we see a small hole, right? You think, oh, it's not so bad, right? Except for the fact that it goes quite deep, right? And could even potentially go into the muscle layer. Any foreign material that may have gotten in, right? So if you stepped it on a wooden spike or something in the yard, this would delay the process, right? We would make sure that we need to remove it. The problem with these types of wounds is a lot of times the skin will heal at the surface and close up this opening. The problem is you still got damage down here below. And if it closes up at the top, what's not getting in? Oxygen's not getting in, right? It's not able to diffuse into the tissue layer, right? Into the muscle layer. So therefore, these type of wounds more often than not become anaerobic. And again, if that nail, right? So for instance, you step on a rusty nail in your yard. It's not the rust that's giving you tetanus, right? It's the fact that the rust indicates, for the most part, how long has that nail been in your yard, if it's been rusted. More than a day or two, right? A good little while. In Louisiana, this happens quite quick, though, because of all the moisture, right? You probably could rust in as little as 4 days. But it means that it's spent a significant time outside, and right? And so what's the likelihood that it may have tetanus spores on it? Pretty high, right? So, because they're readily available in the soil and the environment, right, for us in this world we live in. So if you step on that, you create a puncture wound for one, right? And so more than likely you're going to get an anaerobic environment. So if those spores were introduced, even though you took that nail out, right, those spores would probably stay behind. And then they're going to germinate in that anaerobic environment. They're going to grow, and they're going to produce the toxin, and then the toxin spreads throughout the blood system. This is why it's crucially important to keep up with your tetanus vaccine. And, of course, if you have a serious wound like this, don't brush it off, right? Go get medical attention, right? Don't try and take care of this yourself at home. You want it cleaned really well. Lacerations, for instance, running into a fire hydrant causing a laceration on your knee. I actually did this in high school, right? Everybody in the line jogging after school for a cross-country track jumped to the side. I wasn't paying attention, ran right into the fire hydrant. So yeah, my knee looked about like that picture. So Pretty jagged wound, right? Fire hydrants are not forgiving. Right? Jagged edges. This usually makes it difficult for the edges of the skin to come back together. And so you usually have quite a long time of healing with this. So usually a large area, right, when you have lacerations. So if it's to a large area, right, or if it's very deep, there is the potential of an anaerobic environment forming. So again, proper wound care, right? Make sure to maintain the cleanliness of it. Keep an eye on it. The first sign of possible infection, seek medical attention. Contusions. So getting hit with a baseball bat. Right? This type of impact will crush tissue, sometimes without breaking the skin. Evidence, right, of this type of wound is seen as a bruise, as seen in this picture. The damage to the blood vessels is why there is the discolorization. Right? Depending on the extent of the damage, an anaerobic environment can be extensive, right? So if you have, right, a lot of bruising, quite extensive, large areas, it's definitely something to keep an eye on. I had that off. I do. Okay. So anybody watch House? Anybody watch it way back in the beginning? Do you know why he lost or has limited function in one of his legs? He had some type of injury. I can't remember what it was. But unfortunately, it caused internal injury, right? So it wasn't very easily seen. And so he had damage to the muscles inside of his leg. And that's what led to the disability he has with his leg in that show, supposedly. Of course, he's an actor, right? It's not real. Any of you guys know Jeff Smith? He's one of the biology and anatomy physics. His mom is like, what, 94 years old now? She thinks that TV is real. Like it's real life. Like that's people's real life. On TV. I just, you know, it's just funny. You know, she's older, you know, she's like a little kid, like trying to explain to a little kid that like what you see on TV all the time isn't real, right? That there are actors acting and playing these roles, that this didn't really happen. I thought it was really funny. Him and I are huge Walking Dead fans, and he said, it's a good thing my mom doesn't watch Walking Dead. I said, thank God. She would think the world is coming to an end. She'd be terrified. I'm terrified, and I know it's fake. All right, so burns. So as I said earlier, right, you know, thermal burns are the most common that we experience, but chemical burns can happen, right? And this is why, too, you guys hopefully learned, too, that a lot of the cleaners that you use are strong acids or strong bases, right? And you really should be cautious when using them to clean, and definitely wear gloves if you have them. If you don't have them, get yourself a pair of gloves, right? To help protect yourself from the damages that these types of chemicals can cause. So all burns, unfortunately, cause death to cells. And again, depending on the extent, how large the surface area that's affected, how deep the damage extends, right? This is why they talk about first degree, second degree, third degree burns, right? This is the degrees of level of damage that has been caused. And of course, the worst is 3. Did they go past 3? I can't remember. I think 3 is the highest. But I mean, trust me, you don't want anyone to tell you have a third degree burn. The problem with this is dead tissue is dead. And therefore, the environment is definitely anaerobic. And this is a twofold problem, because if it's dead, Y'all, it can't be repaired. And instead, it's just a readily available food supply to microorganisms. And man, they eat that stuff up. So that's why when you have a serious burn, 2nd to 3rd degree burn, right, why they will go and they do debridement, which is basically they remove the dead skin. But depending on and for the most part, when you have burns, they want to make sure that you're going to survive, right? So unfortunately, they don't give you any type of anesthetic usually when they're doing this. So it's extremely painful, right? Because they can't take the chance of you not coming back out of it, right? But there's a reason why they're torturing you like that, right? Or an individual that's had a burn like that, is because that dead tissue, again, is just a home for bacteria. If it's not removed, you're going to get infection, guaranteed, right? Guaranteed. You have no way of defending it. It's dead. You can't repair it. You can't rejuvenate it. It's a loss, right? So, my husband has a huge wound on his leg. I like to tell my friends he got bit by a shark, but it's not that elegant of a story. He had a contusion. Back home where I live, we get snowstorms. They had a snowstorm this week in April, right? This is why I live in Louisiana now, right? April? Snow? Really? Should you be done by then? So the girl's next door's Jeep was stuck in a snowbank, right? They had plowed her in. She needed to get to work. She was a nurse, actually. My idiot father-in-law shoved a 2x4 underneath her tire and to try and get her up out of the snow. My husband was pushing on the truck, and his dad hit the accelerator, and it flew the 2x4 into my husband's shin. So he had a little tiny wound, right? Hurt like hell, but he's a big, huge, strong guy, right? Went on shoveling for the rest of the day. Never went to the hospital, never went to the doctor, right? His mom, who's also a nurse, several weeks later, he's sitting on her couch. Big, huge bruise, black, just nasty looking. The wound is looking gross. She's like, you're going to the ER now. If he had not have gone, he would have died because the infection had spread to his bone. He had to sit on her couch for the next month and a half with IV antibiotics, right? Don't just shake it off, right? Big burly men could lose their legs, right? Over what seemed like not a very serious wound. But think about how that wound happened, right? Come on, right? He learned his lesson the hard way. So because of the infection, they had to go in and cut it out. So he has a big, huge fillet wound in his calf from where they had to go in and cut it out to save his life, or save his leg, and potentially his life. So don't laugh off wounds, y'all. Don't muscle it up and be like, oh, it's no big deal, because you might regret that later. There was a guy when I was working in a doctor's office in California, got a fish barb in his finger, right? Man, that sucker blew up in like 2 days, right? He didn't go and get it cleaned out properly, and man, there was some nasty bacteria that got in there. He almost lost his finger. Right? So, and that happens a lot here too. I know a lot of fishermen and stuff here, right? That get, jabbed puncture wounds with fish and from shrimp and stuff like that. Bacteria gets in, it can be a really serious infection. So you always want to get proper wound care, and some of that you really just can't do at home. You've got to spend a couple of 50 whatever bucks, right? Go to urgent care, right? And get it cleaned out properly. So gunshot wounds, again, unlike in the movies, right, I wouldn't suggest having somebody take care of this for you. This is a trip to the emergency room, right? No matter where it hit you in the body, right, this is not something we're going to mess around with. And again, it has to do with the damage, where the damage is, and that potential of that anaerobic environment forming. And that really, is much more conducive to infection than anything else. So that's the really scary thing with wounds, right, is the damage that happens, and therefore the potential infection that can ensue. So the bottom line, Breaks in the skin allow entry, right? That's our wall. The wall has been breached, and they're in the body. All wounds result in some damage to blood vessels, therefore decreases the diffusion, right, of oxygen into the area, resulting in anaerobic environment. Some pathogenic organisms thrive in anaerobic environments, or even require them to grow. Dead tissue cannot be saved, right? It is a liability because it can be used as a food source for microorganisms. So I don't know what happened with Dr. Attard's dad, but I think it's one of those situations too where, you know, a lot of times too when you're a doctor or medical professional, you try to take care of things yourself, right? And then you realize, oh crap, it's you know, I need additional help. And then you end up having to have surgery, you know, where probably if he'd gotten some help in the beginning, probably could have avoided that. So, a friend of mine that works here as well, she lost her dad. He was a doctor, self-medicating, self-taking care of. Didn't realize he had gotten really serious pneumonia from one of his patients and died over Thanksgiving holiday. Drowned in his own fluids. And if he'd gotten treatment earlier, antibiotic treatment, he could have potentially survived. So don't mess around with medical care, right? It's not worth it. It's not worth it. So the different types, right? So which ones do you think we have to worry about for anaerobic environment more so than not? Little review from what we've been talking about. So do we have to worry about with incisions anaerobic environments forming? Not so much. Puncture wounds? Absolutely, right? Lacerations? Depends, right, on how severe. Contusions? Yeah, because you got a lot of damage to blood vessels, right? That's why, right, you'll see the bruise sometimes, right, if it's towards the surface. This is the bad thing too, like, you know, this is the whole big controversy with that movie. I didn't see it. Anyone see Contusion? With about the football players and, you know, concussion, that's it, concussion. I'm thinking contusion, concussion. But same thing, right? The problem is that, you know, the whole laws of physics, right? The body is moving, you quickly stop. Brain still keeps moving, smashes into the skull, right? So this is a you know, impact type wounds to the brain of all things, right? Which can cause some pretty serious damage and serious problems. So the problem too, you know, with concussions again is the damage, right? And especially blood vessel damage. That this could result in an anaerobic environment. And burns, if you've got dead tissue, is that aerobic or anaerobic? It's definitely anaerobic, right? So puncture wounds and burns are the worst, but also contusions, right, can result in anaerobic environments. Why do we not worry, though, so much about bruises, though, most of the time? What doesn't happen? So when we have an incision, what's damaged? The skin, right? When we have a bruise, that's tissue under the skin, right? Is the skin itself damaged? No. So you still usually have that protective barrier. So unless microorganisms are, say, in your blood, right, or something like that, you're usually okay, right? Because you don't have microorganisms in that environment where the damage happened. Make sense? Okay. So we really got to look out for burns and puncture wounds, right? These are things you go and get medical help for sure. What endospore-producing bacteria do we worry about germinating in wounds that have anaerobic environments? And that, of course, is Clostridium tetani, right? Because that is an anaerobe. It will grow in an anaerobic environment in you. So the three tissue components that become exposed by wounds that the pathogens will attach to. So your collagen, your fibronectin, your fibrogen or fibrin, right, that form in clots. Bacteria have developed the ability to attach to these substances. Of course, these are not exposed in the outer layer of your skin, right? This is exposed when you have damage to the skin. And then the microorganisms are able to attach to it. Because remember, the first thing for infection is attachment, right? So these substances, unfortunately, they're going to attach to. What's the benefit and what are the harmful aspects of abscess formation? So what abscesses are is a local collection of pus surrounded by body tissue. The good news with an abscess means that you have a localization of an infection, right? Or we're keeping the infection in that particular area. The problem is if they escape, right? So if you have this festering infection, right, your body isn't able to clear the bacteria, right, that are in there. And typically abscess formations happens with bacteria. You're not going to get this with a virus, right? So you have a bacterial infection, right, there where it's localized, right, it's in the skin or under the skin. The problem is if bacteria escape from this, right? So an abscess is where we're walling it off, right? We're keeping it in one area, but it's going to increase in size because we're not actually killing the bacteria in the wound. So if they escape, right, from that area into the tissue, that can lead to further infection. To effect a cure, abscesses must rupture to a body surface or be surgically drained. And so again, this is a problem where, you know, you don't really necessarily want to deal with some of these things yourself. You got to go into a doctor's office. You need to have it lanced cleanly, to be cleaned properly, done with clean instruments. And because, again, the pus, right, is bacteria, dead neutrophils, right? It could be a source of infection for other parts of your body as well. So if the body isn't pushing it to the surface on its own, right, if it's just getting bigger and bigger, you need to go to the doctor's office and have it lanced cleanly and removed cleanly. Because you don't want to risk infection. Or further infection, we should say, right? An abscess is definitely an infection. It's a special type of infection. So you guys will notice, too, in these chapters coming up, we're not going to cover every infection, right, in the chapter. We're just going to focus on a few, which I'm sure none of you guys have a problem with not covering every single little thing in the chapter. And this doesn't have anything to do with the fact that we're running out of time. This is what I always do for these chapters, right? I haven't augmented them as of yet. So there are some important questions that we ask as it relates to each infection. You'll notice we'll ask these same questions over and over and over again. And you'll be like, why do we need to know this, right? But it's important to how we, of course, either prevent or treat or cure different types of infections and diseases. So Pseudomonas aeruginosa is a species of bacteria. It's pretty bad bacteria, you could say. And so you'll notice that one of the questions that we always are going to ask when we talk about bacteria is it gram-positive or gram-negative? Does anybody want to gander a guess on why we would want to know that? For treatment purposes. Because remember, can we give straight up penicillin for a gram-negative infection? Yeah, you could, but you wouldn't help your patient. Right? Because gram-negatives are naturally resistant because of their outer membrane to penicillin. So the more we know about what's causing an infection, the better we can treat, right, and potentially cure. If you didn't know any better and you think, oh, well, we're just going to give them antibiotics, we're just going to give them penicillin because they have a bacterial infection, then in this case, again, you're not going to help your patient. So the more we know about the bad guys, the better we can destroy them, right? So knowing whether it's gram-positive or gram-negative really helps us with treatment, especially when we're employing antibiotics. And especially nowadays, where you don't want to keep throwing broad-spectrum antibiotics at your patients. Broad-spectrum antibiotics cover a wide range, right? Which means you're also going to affect your normal flora. And if it doesn't work against the bacteria, then you've just exposed other bacteria to this antibiotic for nothing. And you greater the likelihood of resistance happening in other populations of bacteria, and maybe even the one you're dealing with. A much better course of action, which pretty soon we're not going to have a choice. Doctors are going to have to run antibiotic sensitivity tests on bacteria because we're going to start running out of options, right? And it's going to get pretty scary in the next 10 to 15 years, I really do believe. And this is why, if you've already haven't noticed it, doctors are very hesitant to even prescribe antibiotics nowadays because of the misuse that's going on for so long. That's really contributed to the amount of resistant bacteria that we have. And if it's resistant, that means we can't use a particular antibiotic against it, right? MRSA, perfect example. Widespread use of penicillin-like drugs to treat Staphylococcus aureus, so much so that now we have a resistant strain out there that's becoming very prevalent, where we have to use another antibiotic. Well, again, they just haphazardly used vancomycin. So bacteria and viruses are going to continually change, right? We can't keep coming up with all different drugs, though, right? They're going to win this race on us. So we really need to be more effective. And the really scary thing with Pseudomonas aeruginosa, gram-negative, so eliminates all, penicillin-like drugs, except for the ones that have been modified for gram-negatives. But this guy, resistant to most of the antibiotics we use on a regular basis. So there's a poster that I'll have out at the expo. We won't have anyone at that table, just people can walk by and read it. That one of my students did in the past. There was a model several years back, got a bladder infection with Pseudomonas and died. She lost her limbs to the infection and then her life to it, right? Because it wasn't diagnosed properly quickly enough. She didn't probably seek medical attention quickly enough, and the infection spread so aggressively, caused so much damage that she eventually lost her life to it. So again, not something to play around with when it comes to infection. So we'll ask questions like anaerobic environment, especially makes sense with wounds, right? With wound care. We want to know if we do have this organism, is it going to grow if we have an anaerobic environment and we have that type of wound? This one has some distinctive features that help in identification. Of course, if you have something that's relatively unique to you, right, this is very good and beneficial to know about. Where does it come from, right? Its reservoir, where does it live? So that'll help us with even avoiding it, right? If you know where it is, you know how to stay away from it. Pathogenicity is really important, right? How is it that it causes infection? Basically, how does it evade our immune system for the amount of time that it does in order to cause the infection, to be able to eat us without us destroying it? Then, of course, how can we prevent? We always want to know how we can prevent these things. And then, of course, we want to be able to treat and treat effectively, right? So these are all important components, right? What do we know about the organism, right? Where does it come from? What does it do in our body? How do we avoid it? And how do we treat it? Right? These are the main themes, right? And some of them are given certain names like epidemiology, right? And pathogenicity, right? But in general terms, that's what we're looking at. So in the interest of time, I've got really cool pictures. But I'm not going to read every slide. I'm just going to give you guys some indications, and then we're going to answer each one of those questions. You'll notice that I have them laid out. So we work with this organism actually in the microbiology lab. It's one of the reasons why we choose to use Lysol in the microbiology lab, because it is known to kill this particular organism. Pseudomonas aeruginosa, when it grows, it produces two pigments, a green and a yellow pigment. I mean a blue and a yellow pigment. When they combine, they form green. So it characteristically has a greenish tinge to its growth. So you can see, and this was probably a burn patient, right? Considering the large, extensive area of damage, I'm thinking they got burned, right? And this organism, also you can see here in this picture, is motile, right? But again, you can see the greenish discolorization. And that's why, too, sometimes they're like, oh, I have green snot, right? You probably maybe have Pseudomonas infection, right? It's a very common infection, unfortunately, sometimes. Because where is this organism found? In our environment, right? In our environment. So I'm trying to think which other one. Okay, so this picture is an antibiotic sensitivity test that we perform in the microbiology lab. We didn't do Pseudomonas this semester, mostly because I just didn't feel like dealing with it. But you can see that even though this is the Kirby-Bauer method, so we put Pseudomonas, so you can see the green discolorization to the plate as it grew, and then we put antibiotic discs on the plate. And then the way this test runs is you measure the zone of inhibition, right, to determine whether it's resistant, intermediate, or susceptible. But look at this disc right here, y'all. It didn't stop the growth at all. And you see how small these zones are, right? I think when we measured this, only one of these antibiotics was actually the bacteria was susceptible to. It was resistant to all the others. So even though in this test we had a little bit of an inhibition of growth, it wasn't enough that you would give this antibiotic to a patient. Right? So we have like, I don't know, 8 different antibiotics now in the microbiology lab. I think only one of them works against Pseudomonas. 1 out of 8. That's pretty scary. So what is it? Is it gram-negative or is it gram-positive? It's gram-negative. And again, why we can't give penicillin. Can it grow under anaerobic conditions? What do you guys think? Look at that wound, right? That was probably a burn, right? So dead tissue, right? But again, it's on the surface, too, so there is oxygenation from the air. But yeah, this guy's a little tricky bug. This one can grow if nitrate is available anaerobically. So mostly on that burn, right, patient, it's growing aerobically because, again, the burn, the skin, right, it's on the surface. So that's kind of a tricky one. But it can grow in the soil where nitrate is available anaerobically. Although this one mostly is an aerobe, right? So if you get a puncture wound with this one, do you have to worry about an infection? If an anaerobic environment forms? Not really. You're not going to have nitrate available to it, right? But a burn where you've got a lot of dead tissue, right, lots of food, you've got an aerobic environment, there is the potential. So the causative agents that this guy produces that helps in the identification, products that this causative agent produces are those dyes, right? So it's the pigment production that you see, that greenish discolorization. So distinctive symptoms would be that greenish discolorization of the affected area. Where do you find Pseudomonas? I said something a moment ago. Soil, right? So it's in our environment. It's readily available, right? It's in soil, so therefore it's in dust, it's in dirt, right? Really difficult to avoid exposure to this organism. And so that's also the main reason why burn patients are in isolation, right? When they have severe burns that they're hospitalized, they're in isolation. This is why they're going to make you put little booties on your feet, right, and gown up, because your feet, you've probably walked on dirt, right? At some point, you've been exposed to dirt. There's no way you're not. So they want to try and kind of clean you up as best you can, right, before you go into their environment to protect them. It's also why they're not going to allow potted plants, right, or usually plants in general, even flowers, in a burn patient's room, because that can be a source of this bacteria. As well as others, right, that we would worry about, like tetanus and things. So what's bad news about this organism? How does it progress? How does it make us sick? Well, like a lot of the ones we really fear, this guy is a toxin producer. He produces toxins that lead to cell death, which of course, if our cells are dying, right, from this toxin, this is going to delay the healing process and progress the infection. So what types of toxins, right? And we've just said it, just repeat it, right? Cell death. Just in general, right? These toxins are causing cell death, which is really bad news. How can we prevent this? How can we avoid a Pseudomonas infection of a wound? What's number one prevention for wounds in general? What are you going to do if you get a wound, y'all? You're going to clean it, right? You're going to clean it, right? Cleaning is the most important thing. Prompt wound care right away. Removing any dead tissue, right? We don't want to leave it any food to eat. And patients with serious wounds should have limited exposure to items that may have the organism, right? So plants, people walking in with dirt on their shoes. So what are we going to do to treat? It's a bacteria. It's a gram-negative bacteria. What are we going to do to treat? Antibiotics, right? But we have to be specific in the antibiotics, right? Because as we've already seen, right, in those pictures and talked about, we can't just throw penicillin at them, right? In addition, you got to remove any dead tissue, right? Whenever you have wounds, you don't want to leave food behind. But also we really, especially with this one, we got to determine antibiotics that would be effective. Because many strains of Pseudomonas, if you're dealing with Pseudomonas, are resistant to a lot of antibiotics. So in systemic infections, right, when it's unfortunately got into the bloodstream, those antibiotics need to be given intravenously in the hospital. So tetanus, right, and as I said, I'm going to skip ahead to our answers for this one. There we go. So the causative agent, right, what causes tetanus? It's not in the name of the disease, or it sort of is, right, only part of the name. So it's Clostridium tetani that causes tetanus. Is it gram-positive or gram-negative? Anyone know? Most of your spore formers are gram-positive. So remember, the special structure that this one produces allows it to live for or survive for long periods of time in harsh conditions is the endospore formation. Can it grow anaerobically? You guys should be able to answer this. I've been talking about it since the beginning this morning. Yes, right? This is the one you worry about with puncture wounds, right? It in fact requires an anaerobic environment to grow. Right? So this is the one we worry about with puncture wounds, because there's a very high likelihood that an anaerobic environment is going to form, right? And this one actually requires it. If it got into that puncture wound, then you're looking at some serious problems. So what's the type of wounds that favor an anaerobic environment? We just said it. Puncture wounds, right? Burns, any wound with a lot of tissue damage, right? But the ones we are usually most concerned with are puncture wounds and burns. I'm going to post this for you. What's a distinctive symptom of this infection? What happens to individuals when they have tetanus? It has a nickname for tetanus. There's another name we call it, lockjaw, right? So it affects muscle relaxation. So lock referring to the jaw locking up, right? So, and that's one of the places where unfortunately it tends to manifest first, right? You don't realize how much you move your jaw until you can't, right? So uncontrolled muscle contraction, right? And as I said, one of the most common areas where we notice it first is in the jaw, or associated with the jaw. The toxin, right, called tetanospasm, what cells does the toxin target? What effect does it have on them? So what tells your muscles relax? Something does, right? What cells in your body tell other cells to do things like contract and relax? Cells. What tells everything what to do in that aspect is muscular contraction. The nervous system, right? So we're talking about neurons, right? Remember those? Okay. In this case, it's the inhibitory neurons, right? Because they're the ones that tell your muscles, okay, relax. Right? There's one that says contract, right? And the other say relax. And of course, yeah, they do it chemically, right? They release neurotransmitters, right, which bind to receptors on the muscle cells and allows them to relax. The problem is that this toxin attacks those inhibitory neurons and stops them from releasing their neurotransmitters. Right? So instead of, contracting and then relaxing, the muscles stay contracted or even spasm, right? Hence the spasm in the name of the toxin. What's the main reservoir where the causative agent is? Where could you find the endospores for tetanus? Readily available in the environment, in the soil, right? So soil, dust, in the intestines of animals, including humans, right? We ingest it and excrete it even into our environment. What's the type of vaccine that we have against this? So this one is important in that, are we giving you the bacteria? No. We're actually giving you a weakened form of the toxin. So this type of vaccine is referred to as a toxoid vaccine. Anyone know any other disease out there that we give you actually the toxin? Another one that's a toxin former. It's combined a lot of times with tetanus. Diphtheria. It's another toxoid vaccine. So this doesn't protect you, right? So you produce antibodies, right, against the toxin. This doesn't protect you against an infection with Clostridium, right? So what are they going to do? Well, we'll answer that in a minute, I think. Why does the vaccine not prevent against the infection? So again, the fact is that the vaccine is specifically targeted at just the toxin, right? Not the bacteria at all, right? So you can still get an infection with tetanus even though you've been vaccinated. The good news, though, is that when that bacteria releases the toxin, you have antibodies that neutralize it, so it doesn't affect you. Make sense? Okay? So it's against the toxin only, not the bacteria. What's an antitoxin? Well, anti means against. So it's something against a toxin. Well, what does your body produce that is going to neutralize toxins? Antibodies. And that's why we want to vaccinate, right? Because we want to get it to produce it ahead of time, right? We don't want to wait the how many days that if you get the infection it would take for them to make an antibody against it. 7 to 14 days, right? You'd probably be toast by then. Not a good thing. Not without treatment. So antibodies against the toxin. When we say antitoxin, that's what we mean. Or even anti-serum, right? Serum contains antibodies. So why is it helpful? Well, what antibodies help us do to toxins? Neutralize them, right? We neutralize them. If the antibody binds, can it bind to us? No, right? Those antibodies block it from binding to us and block it from being able to attack our cells. And then also helps us clear it from the body. So if you haven't been vaccinated, right, we can inject someone else's antibodies into you. The person would take 7 to 14 days to make their own themselves, right? In that time, the toxin would kill a person. So if you don't have the antibodies, we can treat you by giving you someone else's antibodies, by giving you antitoxin. Oh, I thought I had. I guess I didn't add it to the list. So let me go back. Because this is our last one for today. So we'll do gas gangrene and cat scratch next time, and we'll start the next one next time. There's one thing. So this is a horrible picture. I don't know if they still have this one in this version of the book. They do? Yeah. So what? Anyone know what happened to this poor infant? Well, obviously tetanus, right? See how he's contracted, right? And he can't. So what wound do we create on a baby? We kind of have to. We cut the umbilical cord, right? In developing countries where they don't have clean environment to do this, sometimes that umbilical cord is what gets infected with the spores, right? And causes the infection and death of the infant. Because again, it's difficult to avoid contact. There was one picture I wanted to show you. Oh, here it is. So, and this is my prelude into, there are some Connect assignments, right? You will notice, I think I have them due maybe the day of the final. I'm not sure. I'll check on it. I don't remember what I did for you guys. But one of them that I suggest that you guys try and work on this week is the antimicrobial medications one. I'm not going to cover that chapter on its own, but as you guys see, I'll talk about several antibiotics and how they work scattered throughout these infections. But I'm not going to test you guys directly on antibiotics, because I don't necessarily want you guys memorizing these, but I want you to have a general understanding of this information. But it's also required content for this class, so to make sure that you guys have read over some more than what I'm going to cover in class, that's why you guys have your Connect assignment, right? But know that the information covered directly in that Connect assignment, you will not be tested on. And in these tests and stuff, even though I tell you guys about the different antibiotics that would be used to treat, I'm not going to test you specifically on the antibiotics. Does that make sense to you guys? Some of this stuff does change, as I said, and has to change, right? But having a general knowledge of antibiotics and their uses and why we use different ones for different things is important. That makes sense to you guys? So for instance, this one is an oral synthetic anti-protozoal and antibacterial agent. And this is actually, some people would call it an antibiotic, but in truth it's just an antimicrobial, because antibiotics actually come from other microorganisms. So penicillin is an antibiotic. It's made by a fungus to inhibit gram-positive bacteria, right? Because they're fighting over food and resources. This is a synthetic drug, right? So we would use the term antimicrobial, right? A more broad term than an antibiotic, which is truly a specific term. A lot of times, unfortunately, people use these terms interchangeably, and that's not a proper use of the term antibiotic, right? But most of the time you don't know better, right? And you just repeat what other people have said. So the trademark name is Fagal, I think, for this one. And the way it works is it interferes with DNA synthesis and function, but only in anaerobic bacteria. So, or anaerobic microorganisms, excuse me, because some protozoa it works against. So a lot of times, like, so for instance with penicillin, it affects the cell wall synthesis of peptidoglycan. So in this case, you know, it's pretty narrow, its scope, because it's interfering with organisms that have a particular set of enzymes used to copy their DNA. And in this case, it's anaerobic microorganisms. The selective toxicity is due to the fact that anaerobic metabolism is required to convert the medication into the active form. All right, so this is one's kind of interesting, right? So the drug goes into the cells, their own metabolism activates it, right? And then it interferes and with the active form binds with DNA, interfering with its synthesis. Vagina infections with certain bacteria and Clostridium difficile as well can be treated, other than tetanus, with this particular antimicrobial. See, even I almost say antibiotic. All right, so I'm done. Thank you for humoring me for a few more minutes. I appreciate it.